Welcome, John. It's with great pleasure I'm here today interviewing you on behalf of Injury Matters. It's really exciting. It's awesome to have you here. Just before we start, I did want to do a quick acknowledgement to the lands in which we meet today. So the lands where I'm dialing in from is the lands of the Whadjuk people of the Noongar Nation, Western Australia, Perth. And I would like to acknowledge the lands on which you're dialing in from as well today, John. Yeah, so great to see you.
Good to see you, Sam. Yes, so much of Deakin is based in the lands of the Wurundjeri people here in Victoria. So we pay our respects to elders past, present and emerging.
Awesome. John, just before we start, can you just tell me a bit about yourself and your role at Communities That Care?
Yeah, so I'm a director of the not-for-profit company Communities That Care that we're going to talk about today. I'm volunteered into that role by my university, Deakin University, here in Victoria. So Deakin has a very strong emphasis on partnerships, and so likes the work that Communities That Care does, where we're going to hear about today. Basically training municipal coalitions in how to increase evidence-based practices that will lead to brighter, happier, less injury futures for children and young people.
Yeah, that's awesome. So can you tell us a bit more around how Communities That Care works?
Yeah, and if you don't mind, I thought it would be good maybe just to share a few slides on this topic that just might give a few insights into it. So I won't get too caught up, but I'll just start off and then we can come back to the discussion. But I think this would be useful just for viewers to have a little bit of an insight of the model. So I'll talk about that in relationship to some overheads here, which I'm now sharing.
Awesome.
And people can see my affiliation. I'm the co-leader of Translation Sciences at Deakin at the Centre for Social and Early Emotional Development. So this is a group that are very much committed to understanding longitudinal studies and how they inform us about the children's development. And also we have a lot of work that's done on evaluating programs, particularly looking at those that have effect on the whole population of children and young people. And we bring these two sets of information together. And Communities That Care has been very much something we're trying to bring the evidence base to. So it's been great working at Deakin there and having terrific partners that are involved in the longitudinal and evaluation studies. So in a nutshell, what this program is trying to do is encourage the use of evidence-based programs really to promote a whole lot of positive things for young people, including mental health, and as we said, to reduce injuries, promote resilience. So it tailors these prevention strategies to local community needs and using a 5-phase process. So the communities work through these using benchmarks and milestones. So they register with Communities That Care to do these 5 phases to a very high standard. And Sam, you'll remember at Mandurah that this journey was taken there in Western Australia, and it has also been done in Bunbury in Western Australia, and parts of it have also been done in Kalgoorlie. So Western Australians do have some experience. Here's the website. People can go and have a closer look. Basically, the phases involve things that we probably are familiar with if we're involved with working with communities. So initially what you really do is it's just a matter of checking in that people are ready to go and they do want to do the model and they want to do a prevention approach. The reason they select this is because there's very strong evidence that it's going to lead to brighter futures for young people. There's normally a community coalition gets registered once they finish this phase 2, and there's also key leader groups are often involved. In phase 3, there's the development of a profile, and there's a youth survey specifically designed to provide epidemiologically valid indicators of risk and protective factors in the local community. And from that, priorities are set for prevention targets, which are then set up in phase 4, where an actual strategy for increasing evidence-based investment is conducted. And then the surveys are repeated at phase 5 to check, have children's outcomes improved in the way that was targeted? over the period that the coalition were working through these phases. And generally the answer is we do see really positive changes occurring. The reason that I'm keen about communities of care is we've got very good evidence for it. So a randomised trial was published, our first year of findings was published here in 2018 in Preventive Medicine, and with my colleague Dr. Bosco Rowland as lead author. That showed that in the first year of doing communities of care, communities achieved a 10% reduction in school-age alcohol use, and also had a significantly increased number of children that intended not to use alcohol till they turned 18. So reduction of alcohol has been a key success with the work we've done. In this evaluation, which was published in Injury Prevention, and you can see this was led by the Monash Injury Prevention Centre, they found a 12% annual reduction in child injury hospitalisations, and that analysis was conducted quite independently. So again, very positive. In 21, we have a report showing reduction in youth crime based on police data in Victoria, with 5% reduction in non-violent youth offending and a 2% overall reduction in violent offending. There's also very clear increased collaboration and care, and evaluations show an economic return of at least $12 for every dollar invested. It's also really quite engaging and meaningful for youth in the community. So I think I might just stop there then, and that just gives us sort of a bit of an overview of what we're talking. And this slide is good because it just at least shows us that there is evidence for what we're talking about.
Yeah, I mean, I can see strong evidence there around reducing injury. So that's really exciting. And I guess my question is, so what risk and protective factors are you looking at or hoping to address in the community? And I guess when you're looking at reducing the alcohol rate in young people, so with that first paper, are you talking like young people aged like, what, say 16 to 17, or are you even talking younger?
Well, we start to measure those effects from age 14. Yep. And the reason for that is during the time we've worked with the program, as you know, Sam, Australia's had historically very high rates of school-age alcohol use. Through efforts that many of us have made working in concert, we've actually brought those down. And from 2009, the guidelines were changed for alcohol in Australia. And that was after a lot of advocacy work to say that children shouldn't be really using alcohol until age 18, preferably. And now it's even stronger statements that were made in the most recent revision. So the reality is that back when we got going with communities that care, it was the majority of kids were using alcohol at age 14. And so we've seen that fall off, and our efforts have been very successful in terms of communities having a faster rate of decline in youth alcohol use than others. Now, if you start using alcohol at age 14, what you find is that that's still a very young age because your brain is still quite plastic, and it's going through a lot of really rapid developmental growth. And it means that the habit of alcohol use becomes much more entrenched, much faster. And so we do find that those early ages of alcohol use that were, as I say, were common in Australia, led to heavy use being very common by the time young people reach the legal drinking age. And of course, what we found in our injury prevention paper was that the efforts we were making to reduce risk factors and increase protective factors through communities of care were actually having an injury prevention effect, as shown through reduced entry to hospitals. Now, the reason for that was not just alcohol. We think there are many other risk factors that we're reducing that are having an injury prevention effect. So they include things like reducing family conflict, which can lead to, angry arguments and hostilities, and then less self-protective behaviours in those situations. Mental health problems, again, can be quite entrenched if you're growing up in an environment where there's a lot of bullying at school. Self-harm can increase, and so it goes on. So there's both intentional and non-intentional injuries that you can reduce if you can actually have kids growing up feeling that stronger sense of well-being and security.
That's amazing, John. So so can you give me some sort of ideas around how a community would practically do some of this work around addressing those risk factors?
Yes, I can. So it may be worth us, again, returning to some overheads to explore this. I think it is helpful sometimes just to sort of see it in practice. I don't want to, dominate the whole thing by just talking only overheads, but I think it is, somewhat handy. So as I talked about those phases, let's go back to them again and think about how this has a relevance for injury prevention. So those first two phases, you're really getting together as a coalition. Now, this coalition might involve you working with local government, school leaders. You're going to bring in the police. There's going to be people coming in from health. And so all of those partners are there with looking at the same, they're ready to look at the same set of data that gives them some information about how young people are tracking. There's training to increase the skills. And here we have groups from around Australia coming together and raising their skills for working in a community collaborative. So there's coordinators providing advice to one another from different places, both online and in the good old days before COVID, face-to-face. Here's pictures from the Mornington Peninsula. As I said, it is actually a meaningful activity for young people. In my role at Deakin University, I'm very keen for young people to come to us ready to go for careers in the prevention field. And we do see that this does whet the appetite working with a coalition and learning about it in your school years. But it's a very good thing for local government to have better partnerships with these students in school, because you can promote different things about growing up feeling healthy, well, and those things are different to place-based initiatives in injury, which had sort of dominated previously. In phase 3, there is a survey. Here we see results from the Mornington Peninsula being presented. They've now done 4 different surveys. They have very good cooperation with all their schools, and they produce quite good glossy reports. Risk and protective factors and their significance is well laid out in this overhead. And we can see that these dots are based on longitudinal evidence. And we can see that there's a dot here because we know that if you measure young people's perception of the availability of drugs, a community risk factor, or alcohol, that will have a longitudinal effect. So it's a dot because the majority of longitudinal studies have found that that will increase the likelihood they'll be having problems with substance use, alcohol, or other drugs when they grow up. And availability of drugs can include tobacco. So there's a lot of research to show that that's a risk factor. And so this is what's defined as a risk factor. So we measure young people's perception of how easy it is to get tobacco, alcohol, other drugs, because we want to reduce this risk factor so we can reduce this longitudinal effect. Now you can see there's lots of other outcomes listed here. There's antisocial behaviour and crime, there's violence over here. School dropout is predicted by a lot of risk factors. Sexual risk-taking, depression, anxiety. So it's actually quite attractive to see reductions in all of these potentially as we reduce community, family, school, peer and individual risk factors. And so it is that's the way that we work there. So communities can actually use their data to pick up programs that will reduce those risk factors. And that's the evidence-based part that occurs in the strategic implementation at phase 4.
Yep. So I assume what you mean by programs is things that are sort of aligned to those 4 areas. So maybe some parenting support programs when their kids are younger, sort of giving them practical skills around role modeling, rules and things like that, sort of supports, or where they can seek support. And then you've got the kids at school, so being engaged in it, having a highly engaging school environment, safe. So I assume that's sort of what ends up happening as you start addressing using evidence-based programs across the 4 domains to support the community. Yeah,
exactly. So for example, one of the evidence-based practices that we found quite useful was having young people who look underage going in to see if they could purchase alcohol in communities. And Sam, you were aware that we did this quite extensively in Mandurah to good effect, in that retailers, as they receive letters of feedback, they reduce that practice. And we're having other methods now that can strengthen that effect. That leads parents to be more confident that they can actually say to the kids, no, you can't have alcohol, and they won't just race down the bottle shop and drink in the park. And so programs have to have a good evidence that they're going to work before we'll recommend them.
Yeah, Yeah. So from that coalition, once it's well established and it is doing, numerous types of coordinations, I assume, what else can they do at a higher level? So like if we think about the National Drug Strategy's 3 pillars of harm minimisation, so we've got demand, supply, and harm. So what other things can they do at a higher level? Say a local government, like what could they sort of take on?
Well, we help them with advice as to what sort of advocacy campaigns that they might want to get into. So for demand reduction, that's a very big effect of communities that care, because we're actually we're pointing them to the very best of the drug education programs that are available. And we keep an evidence-based registry that we continually update to make sure that as new programs come, for example, really good online programs are now emerging, and schools, we're encouraging the schools to adopt those programs because they have stronger effects in changing the demand. So demand being that idea that young people actually, their motivations to go out and seek alcohol and drugs can be reduced through these, good programs. When we think of supply reduction, what we do there is we try and enforce regulations for alcohol and tobacco, and also what we're trying to do there is also think about things like, not just the underage alcohol sales, which were very common. In fact, the majority of retailers would sell to an underage looking youth when we first get going in many communities. But we can reduce that in sports clubs is another problem that we can actually help. But it's also possible to do the same sort of thing with intoxicated patrons. You have a confederate who sees if they can buy when they act intoxicated, and if they can, you can provide feedback and actually monitor those sites if it's a policing partnership. So working with police is the other part. For harm reduction, we try and increase protective factors. And so the idea of that is that everyone matters, and doesn't matter, you might have not had good beginnings and you might be in a lot of trouble. But if you're protected by lots of people around you who you have a strong bond with, and so bonding and care is a big part of what we do, increase through sports clubs or mentors or particular peers who have a better understanding of what we describe as a model by which you can increase opportunities, recognition and skills to form a strong social bond with somebody who otherwise might be excluded in the community. And that can reduce harm. Even if you're still, somebody who's motivated to use drugs, you'll be safer in an environment where people are looking out for you.
Yeah, that's amazing, John. And I think you've given some real insights into the broad, I suppose, ability of communities to come together and achieve such amazing outcomes. So, from working with parents through to working with the police and doing some sort of real population-based stuff at the same time, it's really incredible. So in terms of next steps, I mean, we obviously have a lot of local governments and stakeholders here in WA. What would you recommend someone does? So is it the state government that comes to you, or is it a local government, or is it even someone like a local drug action group or a local drug action team? So who do you sort of commonly speak to, and how would they go about coming to you?
Well, now in the post-COVID environment, we actually do have a lot of interest where communities are starting to, get up again and look at what do we do now into the future, because we've been sort of stopped from doing things we wanted to over a period of time. There's a lot of interest in working in coalition with mental health, because children obviously have been socially isolated. Not all of them have suffered, but there is increased mental health load. And so thinking of injury prevention, working in partnership with mental health is probably one of our key messages. And we think Communities that Care provides an excellent platform for that. The first step, doesn't matter who you are or where you are, you can actually host a readiness meeting. That's a phase 1 meeting of our platform. And even if the community makes the decision that this isn't right for them, they still come out of that learning a lot about prevention, being clear about who the people are that would be on a coalition. And they might make a decision not to proceed because there's already something good happening, or because they've got other fish they're frying in aged care or in another population sector.
Oh, that sounds great, John. So anyone can reach out and have that first meeting. I think that sounds exciting. And I've seen you in
Absolutely.
action in Mandurah, so it would be wonderful if more people reached out and had John visit their community and talk through some of these really interesting initiatives and things that they can do. So
Yeah, great.
yeah,
That'd be fantastic. That's it.
yeah. Thanks for your time, John, and we look forward to seeing you in September.
Excellent. Looking forward to it.
No problem. Thank you.
Thank you.